Hello mga ka-nursing, welcome back to our channel. Again, my name is Joel Pascua, and for today we are going to continue the discussion about the nursing process. Okay, but if you're not yet a subscriber of this channel, please don't forget to click the subscribe button. Okay, and of course hit the notification bell, like, comment, and share this video as well. Okay, so the first part of this video is in the description box. Okay, so if you want to watch the video first before you go with this one, kindly access that the link on our description box at panoorin nyo muna yung first part ng ating nursing process. Okay, so para magkaroon na kayo ng overview, the first part of the nursing process that we did discuss is about the overview of nursing process. Basically, the relationship of your critical thinking skills to the application of nursing process. And we did discuss the first part of nursing process, which is your assessment. Assessment is basically the gathering of information or data, okay, about the patient that can be used now to the succeeding phases of the nursing process. Okay, so that's the first part. Again, it is in the description box. Kindly please watch it first before you proceed to this video. Okay, and for today, we are going to discuss the second phase of the nursing process, which is your nursing diagnosis. Again, na-discuss natin that there are 5 phases in your nursing process. We have your ADPI. Your A stands for assessment. D is for your diagnosis or nursing diagnosis. We have your planning, followed by your implementation and your evaluation. So the first part we already discussed. We have a separate video for that. And this is the second phase. Now, let us define what is nursing diagnosis. Nursing diagnosis, according to the book of Kuzir and Herbs, is the analyzing and synthesizing of data. So what are these data? These are the information we have gathered. These are the information we have gathered during the assessment phase. Okay, during the assessment phase. And this data will now be useful to create it will be analyzed by the nurse and create now a nursing diagnosis. So we will be utilizing those data to create now your nursing diagnosis. Okay, so first is we're going to analyze those data using now our critical thinking skills, relating now every information that we have gathered until such time that it is enough for us to create now your nursing diagnosis or synthesize your nursing diagnosis. Now, okay, what are the goals? Why do we need to do your nursing diagnosis? So your the goals in doing your nursing diagnosis. Number one, we have to identify the client strengths. So okay, we're going to identify the client strengths. So client strengths includes now the ability of the client or the patient to maintain an optimum level of functioning or yung tinatawag nating wellness status. Okay, now another one is to identify health problems that can either be prevented or resolved. Okay, prevented or resolved. Mas malilinawan tayo mamaya dito kasi nga meron tayong tinatawag na actual nursing diagnosis and of course meron din tayong tinatawag na risk diagnosis. Yung strengths naman po, yan yung mga tinatawag nating wellness diagnosis. Those are the types of nursing diagnosis that we will be discussing later on. And the last goal is to develop a list of nursing and collaborative problems, which will be later on the basis of our planning to set the goal and of course to choose whatever interventions is needed to address the condition or the problem identified during this phase, which is your nursing diagnosis. Now, pag pinag-usapan natin ng nursing diagnosis, whenever we hear the word diagnosis, okay, madalas natin naririnig ito sa mga doktor. Pag nagpapa-check up tayo, okay, tinatanong natin or tinatanong ng pasyente, ano po ang diagnosis ng doktor? Anong diagnosis nyo sa akin? Okay, ngayon, ano nga bang pagkakaiba? So what is the difference between a nursing diagnosis versus now a medical diagnosis? Okay, so what is the difference between these two phrases or terms to describe now? Okay, now the difference are the following. So let's discuss nursing diagnosis and your medical diagnosis. Nursing diagnosis, from the word itself, nursing diagnosis, these are the clinical judgment made by the nurse. These are the clinical judgment made by the nurse. Okay, and this clinical judgment, once identified, okay, This can be the conditions that nurses, by virtue of their experience, education, and expertise, are licensed to treat. Okay? Are licensed to treat. Ibig sabihin, ito yung statement na pwede nating gawin kasi nurses cannot make a medical diagnosis. We can only classify and make use of the nursing diagnosis, okay, to describe the problems that nurses can treat or manage as nurses or as professional nurses, while medical diagnoses are made by physician, and only a physician can treat or manage these conditions. Without them, okay, medyo limited yung magagawa nating nursing as nurses. But there are things that once we actually identify this problem, or as a nurse, kaya ko itong gamutin. Okay, kaya ko itong gamutin. Like for example, hyperthermia. Hyperthermia, or yung hyperthermia is a term describe yung diagnosis for a fever. Okay, gagamutin niya ng mga doktor through paracetamol. Okay, or pag may ongoing infection, they give antibiotic. While for nurses, we define it as an increased body temperature. So yun yung statement na ginagamit natin. And there are ways na pwede natin gawin as independent interventions to address the condition. We are going to describe more on that later on pagdating natin sa mga examples ng nursing diagnosis. Okay? So let us proceed. Now, what are the components of ANANDA? Okay, what are the components of ANANDA, nursing diagnosis? Ano nga po ba ang components, or what are the components of NANDA diagnosis? Question is, what is NANDA? Okay, so what is NANDA? So, ang NANDA, siguro familiar kayo dito sa NANDA. Okay, NANDA is yung ginagamit natin ng mga professional nurses, okay, which stands for North American, okay, which stands for North American, okay, North American Nursing Diagnosis Association. So North American, okay, para sa mga hindi familiar, North American Nursing, okay, pasensya na po sa aking sulat, okay, Diagnosis Association. Okay, North American Nursing Diagnosis Association. So what is it all about, sir? So your NANDA, nursing diagnosis, is the universally accepted, okay, compilations of nursing diagnosis na pwede nating gawin bilang mga nurses. Ina-update din po ito from time to time. Okay, and as a nurse, we have to be we have to be familiarized with this one kasi nga if you go abroad like in the UK or in the United States, the same thing. Ito yung mga accepted nursing diagnosis na pwede nating gawin. Okay? Or pwede nating gamitin whenever we do our charting. So what are these? Okay? Your components of NANDA. So we are already clear with the NANDA nursing diagnosis. Again, this is adopted. Okay? This is the universally acceptable compilation of nursing diagnosis that we can use, okay, as nursing professions. Now, the components includes the problem and its definition. Okay, another one is the etiology, okay, and the defining characteristics. We are going to discuss this one by one. It's very important for us to be familiarized with these components kasi nga sila yung bubuo sa isang nursing diagnosis which is written in the NANDA. Okay? Pag-usapan natin isa-isa. Let's start with your problem and its definition. The problem and its definition. So the problem or its definition is also known as your diagnostic label. Okay? Diagnostic label, or simply what we know as your nursing problem. Okay? So that is your diagnostic label or your nursing problem. Okay, nursing problem. So this client's help, this refers now to the client's health problem or response for which nursing therapy is given. So this is the client's health problem or response for which nursing therapy is given. Anyway, I'm going to give examples of these in all the components so that you will be able to understand it more later on pag punta tayo sa examples. Okay? Now, it describes now the health status clearly. It describes the health status clearly and concisely. So clearly and concisely in a few words. In a few words. So may shortcut tayo. Keywords ang ginagamit natin to create now your nursing diagnosis. And the purpose of this is to create now, or the basis, or this would be the basis of the client's goal and desired outcomes. So basically, ito yung problema na gusto nating baguhin later on. These are the problems that we want to change later on. Okay, and this will be reflected in your planning, okay, as part of your goal or your desired outcome. So that is the first component, or the problem and definition, also known as your diagnostic label or nursing problem. The second component of a nursing diagnosis is the etiology. So from the word itself, etiology, okay? Etiology is the cause, okay? So this is one or more probable cause of the health problem. Basically, ano ang sanhi? Ano ang sanhi ng problema? Okay, ano ang nagkukos ng problema, or the related factors, okay? So it gives now direction to the required therapy and enables the nurse to individualize the client's care. Again, your etiology are the cause, okay? Cause or the risk factors, okay? The risk factors that leads now to the development of a condition. Okay, that is your etiology. Okay, related factors and risk factors. Okay, related factors and risk factors. Again, mas maintindihan nyo po ito mamaya once we go to the examples of a complete nursing diagnosis. Okay, let me proceed to the third one. So the third component is the defining characteristics. So defining characteristics is the third component of your nursing diagnosis, which is now the cluster of signs and symptoms. So this basically the manifestations that the patient has to support the claim, or to support the nursing diagnosis, or the nursing problem, or the diagnostic label. So the cluster of signs and symptoms, or the manifestations, okay? The manifestations. Again, pag sinabi nating manifestations, guys, para siyang manifestations, these are just the collective term to describe the signs and symptoms, okay? The signs and symptoms. So these are defining characteristics, okay? We make use of the cluster in signs and symptoms if the problem or the diagnosis or diagnostic label is an actual nursing diagnosis. While for risk diagnosis, no subjective and objective signs are present. So hindi, not necessarily na kailangang may signs and symptoms before we can conclude that there is a risk diagnosis. However, there should be a factors that can cause the client to be vulnerable to the problem. Okay, so any situations, any factors, conditions that may now contribute to the development of a certain health problem, even though wala pang signs and symptoms. Okay, so yun po yung pwede natin gamitin. So pwede tayong hindi magkaroon ng defining characteristics kapag ang diagnosis natin is risk diagnosis. I am going to elaborate that later on once we go to the different types of your nursing diagnosis. Now, let's go now to the ways, or to the ways on how to formulate your nursing diagnosis, okay, or how to formulate your diagnostic statement. So this is the very important part of this discussion, kasi nga pagdating nyo sa duty nyo, okay, ito yung lagi nyong ilalagay sa inyong FDAR, which is your focus, okay, which is your focus. At sa inyong nursing care plan, of course, this will be the diagnosis part, or the nursing diagnosis part, and this is how you're going to create, okay, a nursing diagnosis that now that will now describe the information or data that you have gathered during the first phase of the nursing process. Now, so there are three ways on how you're going to create or formulate your diagnostic statement. Number one is the basic 2 parts, followed by your basic 3 parts, and the last one is the 1-part statement nursing diagnosis. We are going to discuss this one by one. Okay, the basic 2-part statement, from the word itself, 2 parts. So, ibig sabihin, this statement has 2 parts. Number 1 is the problem or the diagnostic label, okay, according now to your NANDA, or the nursing problem. Okay, so these are the statements of the client's response. Okay, the second part of this nursing diagnosis is the etiology or the causative factors or the cause or the factors that contributes now to or probable causes of the response. So yung nagkukos ng ating problema. So these are commonly joined. So pag pinag-usapan po natin ang two parts statement, these are commonly joined by related to, other than, rather than due to. Bakit related to? Kasi pag due to, this is more on cause. Okay? This is more on cause. Kapag sure po tayo na yung sanhi or cause noong health problem is because of this condition, we make use of due. Okay? Due to. Pero kapag we are unsure that the cause of the condition is yung point na yon, okay? Pero alam natin na may kinalaman or probable na may kinalaman, we make use of the word related to. For us to understand this better, let's go with example. Okay, for example, with this nursing diagnosis, constipation related to, okay, to prolonged laxative use. Okay, related to prolonged laxative use. We make use of the related to. Okay, kasi nga, hindi naman tayo sure, okay, hindi naman tayo sure kung ito talagang laxative use ang may sanhi. But based on knowledge and based on literature, pwedeng maging sanhi ang prolonged use of laxative para magkaroon ng constipation. Okay, kaya related to ang ginamit natin just to describe the possible cause. Okay, possible cause or the factors that contributes to the development of the nursing problem. So this is your nursing problem and this is your etiology or the related factors. Ano yung wala? Wala tayong defining characteristics. And that is an example of your basic two parts. Okay? Another one is your anxiety related to threat to possible cancer diagnosis. So patient has anxiety, that is the nursing problem or the nursing diagnosis, and threat to possible cancer diagnosis, that is your etiology. Again, wala tayong defining characteristics. Wala tayong defining characteristics. Okay? That is an example of basic two parts statement. Another one is the basic three parts as statement. So the basic three-part statements, since three parts po ito, meron tayo ng tatlong component. Number one is the problem, followed by your etiology or the factors, and the third one is the defining characteristics or the signs and symptoms manifested by the client. Okay, example, these are commonly used, okay, to document actual nursing diagnosis. Kung kanina, okay, is more on the risk diagnosis, yung basic two parts, ang ating actual diagnosis, common naman po na ginagamit natin ang basic three parts. Kasi pag sinabing actual diagnosis, there is an actual problem. There is an actual problem or there is an actual signs and symptoms. There is an actual signs and symptoms. For us to better understand this, example. Okay? Example, okay? So PES format or the PES, problem statement, your etiology and in signs, symptoms, recommended for beginning diagnosticians. So if you are a first year students, you will be having your duty by second year. So it is recommended na ito yung mga gamitin nating format in order in creating your nursing diagnosis. Okay, now the example is the following. Okay, there is an increased body temperature. Okay, increased body temperature due to unknown etiology. We make use of the known etiology because there are instances that the main problem does not present any possible etiological factors. Okay, parang unknown sa'yo. Pag-uusapan natin ang unknown etiology later on, as evidenced by temperature reading of 38.9. So that is the defining characteristics. So this is the nursing problem. This is the etiology. Okay. And this is your defining characteristics. More example will be given later on. Okay, at least alam na natin pag basic three parts, kailangan meron si problem, statement, your etiology, and your defining characteristics. Let's go to the third one, your one-part statements. One-part statements, okay, ito yung non-the-label only. Ibig sabihin, the only component that is present with this type of nursing diagnosis is the non-the-label or the diagnostic label or the nursing problem only. Sila lang po ang meron. And it parang stand-alone nursing diagnosis siya. Okay? So these are commonly used to describe now your health promotion diagnosis or yung tinatawag nating wellness diagnosis. Wellness diagnosis. Okay? These are commonly also used during a syndrome diagnosis. Okay, syndrome diagnosis. Pag sinabi nating syndrome diagnosis, there is a group, okay? There is a group of, okay, signs and symptoms. Okay, example of this one is readiness for enhanced coping mechanism. Okay, readiness for enhanced coping mechanism. So that is only the diagnostic label. Present po ito. Okay, this is an example of wellness diagnosis and this is actually from the NANDA itself. Okay, another one is readiness for enhanced parenting. Okay, readiness for enhanced parenting. Again, this is a standalone or one-part statement nursing diagnosis that is also in your NANDA. Okay, that is also in your NANDA. I hope that is clear with everyone. Again, pag one part, NANDA label only. Two part, we have your NANDA label plus the etiology. And the third one is the three parts, which includes now the three components, which is your etiology, your nursing problem or diagnostic label, and the signs and symptoms or your defining characteristics. Okay, let me proceed. The status of the nursing diagnosis whenever we create, okay, refers now to the actuality and potentiality of the problem or syndrome or categorization of the nursing diagnosis as a health promotion diagnosis. Okay, now this may be, okay, this can be an actual diagnosis. So ito yung types po natin, the status or the types. Okay, so it can be an actual diagnosis, meaning at the present time, okay, the client problem at the present time. For example, may mga abnormal values tayong na assess. Abnormal values. What else? Obvious signs and symptoms. For example, ang taas ng BP ng pasyente, ang pasyente is nag-chill, ang pasyente mataas ang temperature, ang kanyang pulse rate ay mataas, nahirapan siyang huminga, okay, any conditions that are present from the moment that you perform your nursing assessment, okay, and it can be a source of actual nursing diagnosis. Okay, the other one is health promotion diagnosis, relates now to the preparedness of the client. Okay, preparedness of the client. So this is manifested by the client's behavior to improve their health condition. Okay, example po nito is yung nakikipag-cooperate siya sa mga nursing interventions, nagve-verbalize siya ng kanyang willingness to participate. Okay, for example, ready na ako sa operasyon, alam ko kakayanin ko ito. Or makita mo yung pasyente nagpe-pray together with his family. So that's actually readiness for enhanced spirituality. Okay? Or nakikita mo yung pasyente maganang kumain, magandang kanyang nutrition, maganda yung kanyang physique, nag-exercise siya. Those are health promotion cues. Okay, pag nakikita mo yung mga yon, pwede tayong gumamit ng tinatawag na health promotion diagnosis. The other one is the risk diagnosis. So risk diagnosis, since risk po ito, hindi kailangan na may existing problem during the assessment. Okay, hindi kailangan. Basta okay, may nakita kang presence of risk factors or any condition that can contribute to the development, okay, of the problem, at hindi mapipigilan unless the nurse intervene. That is an example of race nursing diagnosis. For example, yung pasyente is sobrang gulo. Okay, sobrang gulo niya lagi. Okay, irritable siya. So, pwede siya malaglag ng kama. So, there is risk for fall. Okay, yung pasyente natin is naoperahan. So, naoperahan since may open wound, pero yung sugat niya is malinis naman, hindi naman namamaga. But still, since there is unimpaired skin integrity, pwede pa rin magkaroon ng infection ng pasyente. So, pwede siyang risk for infection. Okay? Yung pasyente natin, nagsusuka, nagtatae, pero wala namang signs ng dehydration. Pero since may factor na pwedeng mag-lead into dehydration, pwede tayong magkaroon ng risk for fluid volume deficit. Pag-uusapan natin yon maya-maya lang. Okay? And then the last one is your syndrome diagnosis. Syndrome diagnosis naman is assigned by the nurse clinical judgment to describe a cluster of nursing diagnosis. For example, yung pasyente natin, there is more than one nursing diagnosis na meron siya. Nilalagnat na nga siya, mataas pa ang BP niya, nagtatai pa siya. So, ang dami mong pwedeng ma-create na nursing diagnosis. At hindi mo naman, so lahat sila pwedeng priority. So, ang ginawa mo is ginawa mo syndrome diagnosis in order for you to address all of these at once. Okay? If it's possible during that situation. So, those are the status of nursing diagnosis that we can actually consider, okay, whenever we are going to formulate or create now your nursing diagnosis. Okay, whenever we create your nursing diagnosis. So after the status of the nursing diagnosis or the types of nursing diagnosis, we are now going to discuss the variations of basic formats. So variations or basic formats are the ways on how are we going to write now this nursing diagnosis. So dito natin may discuss yung sinasabi ko kanina, unknown etiology, syndromic, okay, and everything. Okay, so let's start with the first one. Let's define first now your unknown etiology. So writing unknown etiology, okay, you're going to write unknown etiology when the defining characteristics are present, but the nurse does not know the cause or contributing factors. Okay, we cannot just simply diagnose the patient ng condition na hindi natin alam or sure na meron yung pasyente. Okay, kasi magkakaroon yun ng misconception later on doon sa charting ng pasyente. And of course, there are instances kasi na talagang parang question mark kung saan nagmumula yung mga symptoms. Like for example, nga yung nagkakaroon siya ng fever. Bakit kaya siya may fever? Sa anong dahilan? Okay, if we try to put the related factor. Okay, so that is unknown etiology. If we are not sure about the contributing factor or the cause of the condition. Another format is using the phrase complex factor. So using the phrase complex factors, we make use of these if there are more than one etiologic factors, okay, than usual. So when too complex to state in a brief phrase. For example, napakahaba noong etiologic factors that is the cause of the nursing problem. Then instead of writing the entire sentence na napakahaba, we can make use of the complex factor. Anyway, guys, we are going to give examples of each of these variations of basic formats of nursing diagnosis for us to better understand this topic. Okay? Using the word possible to describe either the problem or the etiology. So possible, okay, if there is a clue, but still we are not quite sure, okay? And using secondary to divide the etiology into two parts, making the statements more descriptive than what is expected. And the last one is adding a second part to the general response or the label to make it more precise. So we are going to give examples of each variations of these formats. So let's go with it. Example of the different variations. Number one, sa etiology, for example, increased body temperature due to unknown etiology as evidenced by a temperature reading of 38.9 degrees Celsius. So may mga instances na nilalagnat ang pasyente pero wala naman possible cause of infection at the moment. For example, wala naman siyang sugat. Hindi naman inuubo, hindi naman sinisipon. Okay, but still, wala naman siyang confirmed medical diagnosis of any infection. Pero bakit siya nilalagnat? Okay? Bakit siya nilalagnat? So there is the defining characteristics. It's very evident. So the diagnosis is increased body temperature. So that's the nursing problem or the diagnostic label. This is the etiology and this is the defining characteristics. So that's an example of writing yung unknown etiology as one of the variation. Another one is increased body temperature due to complex factor. Ito naman, sinusulat natin kung napakaraming pwedeng mag-cause ng kanyang condition. Like for example, meron siyang recent surgery, post-operative siya. So may na-operan siya, so may open wound siya. At nakita natin is meron siyang inflammation. At the same time, meron din siyang pneumonia, inuubo at sinisipon with productive cough. Okay? Productive cough. So that can be two causes. So napakahaba kung ilalagay lahat. So we can just make use of complex factors to define it. Okay? Or to write the nursing diagnosis. Another one is ineffective coping related to. We make use of the related to for possible anxiety related to possible anxiety as evidenced by frequent crying and irritability. Okay? Related to possible anxiety. So we make use of the word possible to describe the condition because we cannot confirm, okay, this one especially anxiety po siya. Okay, it's more on psychological thought process. We are not really sure. So possible din naman kasi nga pwede nga naman magkaroon ng ineffective coping at manifested ito by crying and irritability kapag ang pasyente ay anxious, okay, or kinakabahan or nababagabag. Okay? Another one is impaired skin integrity related to pruritus secondary to pediculosis capitis. Okay, yung pediculosis capitis po kasi hindi natin pwedeng gamitin na related factor directly. Why? Because that is already a medical diagnosis. So what we did is that we write the nursing problem, impaired skin integrity, kasi kamot siya ng kapot. So bakit nagkaroon ng impaired skin integrity? Because of the pruritus. Kamot siya ng kapos. Kamot siya ng kamot. Itchiness. Okay? Bakit nagkaroon ng pruritus? Kasi nga may pediculosis capitis ang pasyente. So pediculosis capitis is your lice. Okay? Kuto po ito. Kuto. Pagkakaroon ng maraming kuto. Okay? And the last one, okay, breaking into several parts, ineffective breathing pattern related to anxiety secondary to disease process as evidenced by. Okay, so kompletong-kompleto ito. Okay, meron na siya dinefine natin. We have divided the two factors that can be the contributory of the nursing problem. So these are the etiologies. Okay, nursing problem. So we have two etiology there that was divided into two using now the secondary term. And meron tayong defining characteristics which is the RR of 32 breaths per minute. So as you can see here, kompleto yung components natin, pero ang ginawa dito, umaba kasi nga, yung ineffective breathing pattern is due to anxiety, at yung anxiety niya ay dahil sa disease prognosis at manifested ito ng respiration of 32 breaths per minute. Okay, so may dalawa. So here, it reflected the cause or factors causing to the first factor. So the factor contributing to the ineffective breathing pattern is the anxiety. Bakit may anxiety? Kasi siya ay nababagabag dahil sa disease prognosis niya or sa kalagayan niya, okay, na nagkakasakit. And ang evidence nito is the 32 breaths per minute, which is above the 12 to 20 breaths per minute na normal respiratory rate. Okay? Sana po maliwanag tayo dyan. We are going to provide more examples or to give more examples sa mga next slides natin. Okay? So these are the general guidelines in writing your nursing diagnosis that we need to follow. Number one there is it has to be stated in terms of problem, not need. Okay, it has to be stated in terms of problem, not need. Again, in terms of problem, we always refer to NANDA. Okay, we always refer to NANDA. Okay, or the North American Nursing Diagnosis Association. Another one is the word the statement so that it is legally advisable. Okay, word the statement so that it is legally advisable. so that it is legally advisable. So yung pwedeng maintindihan legally, since documentation or the document will be a part of the legal documents pertaining now to your patient. Another one is use non-judgmental statement. So use non-judgmental statement, hindi yung sabihin mo the patient is having psychosis kahit anxiety lang naman yung condition niya. Okay? So next is make sure that both elements of the statements do not say the same thing. Okay, sorry for that typographical error. So do not say the same thing. So make sure that both elements of the statements do not say the same thing. Okay, be sure that cause and effect are correctly stated. We're going to present that later on sa ating examples. Another part of the guidelines is word the diagnosis specifically and precisely to provide direction for planning interventions. Kailangan malinaw yung nursing problem sa ating nursing diagnosis because that would be the basis of our goals during the planning phase. Okay? Use nursing terminology rather than medical terminology to describe the client's response. Tulad nga ng sabi ko kanina, instead of using hypothermia, we make use of your increased body temperature. Okay? Sa ating nursing language or nursing terminology. And use nursing terminology to describe the probable cause of the client's response. Okay, of the client's response. So these are the guidelines in writing now your nursing diagnosis. Okay, now again, the nursing diagnosis is based on NANDA and meron tayong tinatawag na nursing taxonomy 2. So the nursing taxonomy 2 is comprises of total of 13. Okay, 13 domains, yeah, 13 domains and 6 classifications. So the first domain is we have your health promotion. Okay, we have your health yeah, I'm sorry for that. So I have your health promotion. Okay, health promotion, then your nutrition, elimination, exchange, activity, rest, perception, self-perception, relationship, role relationship. And we have your sexuality, coping stress, life, safety, protection, comfort, and your growth and development. And each domain has classification. Okay, has classification. For this one, pwede natin may check ito. So you really need to have an ANDA book, okay, before you have your duty, especially if you are the second year. Okay, in the book. So these are the classifications under each domain under the nursing taxonomy, which is written in your NANDA. Okay, which is written in your NANDA. Siguro we will find time para ituro ko sa inyo on how to use the NANDA. So as of the moment, dito muna tayo sa basic. Okay, so hello guys, thank you for tuning in. Before you continue with this video, don't forget to subscribe now na. And of course, comment, like, and share this video sa ating mga kapwa nurses. Thank you, and please continue watching the video. Bye! Okay, now, so let us put things into practice and try to apply what we have learned so far about how to create your nursing diagnosis based now on the guidelines and the information about concepts we have discussed about your nursing process. Okay, so with the example of situation or example of the nursing diagnosis I am going to show now in your screen. I'm showing you now in your screen. We will try to identify now what are or what is, okay, the diagnostic label on this one, and what is the etiology, and of course the defining characteristics. So these are the three components of a good nursing diagnosis. So based on the example of a complete nursing diagnosis that we have on the screen, try to write it in your paper and try to answer the or to put, okay, the phrase or words that corresponds to each component. So component number 1 is your diagnostic label, and component number 2 is your etiology, and component number 3 is your defining characteristics. Okay, I'll give you about 10 seconds or 15 seconds, I should say. Okay, let us analyze. Okay, on the give an example here. Ineffective airway clearance related to excess mucus as manifested by oxygen saturation of 93%. Okay, we are going to divide or try um, to identify which is the diagnostic label, which is the etiology, and which is the defining characteristics. Okay, for this one, the diagnostic label refers now to the ineffective airway clearance. So this ineffective airway clearance is based on the NANDA, okay, that we have discussed on the earlier part of this video. Okay, so that is actually the client response that we need to address, okay, which is considered as the nursing problem. Okay, so that is your diagnostic label or your nursing problem. Okay, your nursing problem. So your etiology is basically the cause or the risk factors now causing the diagnostic label or the problem. So here, that is your related to mucus, okay? Related to mucus, excess mucus. So that is your etiology. That is your etiology. So that is your etiology. And the defining characteristics, which will now give a definitive um, ex- um, example or the definitive characteristics of the problem that we have, okay, that will now help us in defining the diagnostic label. Okay, this is your 93% oxygen saturation because the normal is supposed to be 95 to 96%. Okay, I mean 95 to 100%, I should say. 95 to 100%. So those are the three parts of your nursing practice that, if not every time, should be present, okay, in the diagnostic or the diagnosis, nursing diagnosis that we are going to make, except that if the nursing problem can be, or the nursing diagnosis can be described using now the two-part or the one-part nursing diagnosis. So depende po yan sa magiging assessment nyo. We will try to find time on how to discuss further on this one, but for this moment po, I'm just going to give a general examples of the nursing diagnosis. Now, to understand this more or better, let me discuss now and give examples on how to create now your nursing diagnosis in relation to the subjective and objective data or the assessment data. So example, so for this example, we are going to identify which one of the priority nursing problem, which is your actual nursing diagnosis. For this example, these are the data that we have collected hypothetically. So for example, the patient says, I feel weak and can't stand doing my activities for the day. So I will no longer write there as verbalized by the patient because we already said in the assessment discussion that subjective data can only be provided by the client. So when I say subjective data, it means to say that this is given by the patient. Okay, now the objective data for this one that would support now the subjective data are the following. Short of breath during exertion. So napapagod daw siya para nahihirapang huminga kapag siya ay gumagalaw. Okay, so what are the cues? The patient appears to be weak. Okay, appears to be weak and exhausted. And it is irritable at times. The vital signs are as follows. 100 over 70 millimeter mercury for the blood pressure. Pulse rate is a bit near the limit, which is 98. The normal pulse rate is 60 to 100 beats per minute. Respiratory rate is above normal, which is 21 breaths per minute. And the temperature is 37.2 degrees Celsius plus oxygen saturation of 92%. So there are several things pwede nating magawa dito or pwede nating ma-identify as your nursing diagnosis. But for this one, I decided to make use of the activity intolerance. Okay? As you can see, pwede naman tayong gumamit ng tinatawag nating ineffective breathing pattern. Kasi nga, the pattern of the respiratory rate, which is from 12 to 20, is abnormal, which is mas mataas siya ng isa. Pero hindi naman kataas. Okay? Pwede naman 92%. Okay, 92% is actually meron siyang ineffective breathing pattern. So, pwede po yan. Okay? Pero dito, um, ang ginamit ko is activity intolerance because ang subjective data ng ating pasyente is more on weak and can stand doing my activities. So weak siya and can stand doing my activities. Ibig sabihin, the patient cannot tolerate to do his job or to do the activities of daily living. Kaya nilagay ko dyan si activity intolerance related to general weakness. Pwede rin naman na gumawa tayo dito ng tinatawag na um, um, multiple factors. Okay, multiple factors diagnosis or syndromic diagnosis. But for this one, I have chosen to use or to give an example for this applicable for this one is actual nursing diagnosis activity intolerance. But again, you can also make use of your ineffective air breathing pattern or ineffective breathing pattern kasi nga medyo abnormal ang kanyang respiratory rate and also your SpO2. Okay, but they are both actual nursing diagnosis. Okay, sana po maliwanag tayo dyan. Another example is the race diagnosis. Again, for race diagnosis, it doesn't necessarily mean na kailangan natin may actual or defining characteristics. All we need to do is all we need to check is there a presence of any factor that can contribute to the development of any condition or situation. So for this one, ang sabi ng pasyente, subjective data would be medyo masakit yung operasyon ko pero kaya naman tiisin. Okay? And then the patient says intact surgical dressing over these are the other objective data. Okay, intact surgical dressing over surgical incision in right posterior leg noted. No redness and inflammation in the incision site observed upon inspection. Patient was responsive and participative in nursing activities. Vitals are as follows. Blood pressure is 120 over 90 millimeter mercury. Pulse rate is 92 BPM, respiratory rate is 19 RPM, and temperature is 37.1 degrees Celsius, while SpO2 is 95%. As you can see, all the vitals are actually on within the normal range, aside from the blood pressure, which is slightly high sa kanyang systole, but still considered as normal kasi nasa limit naman po siya. Okay? And the subjective data does not denote any problem also. Wala namang sinasabi ang pasyente na problema. It says there na medyo masakit. Mostly sa atin, baka mag-diagnosis na naman ng pain or acute pain related to, okay? But the thing is, ang description kasi ng pasyente is medyo masakit. Okay, so we can also rate the pain. However, for this one, expected naman po talaga na masakit. Okay, yung kanyang operasyon. And take note, meron na rin po nakaagapay dito na pain reliever. Okay, so hindi naman siya much problem na talagang hindi na-address on time kasi na-address na siya kasi nga may order ang doktor na pain reliever. So, this is an example of a possible risk diagnosis for infection. Okay, bakit? Because there is alteration in the skin. As you can see, the given example or the given information, the subjective and objective data, does not reflect too much problem or hindi naman siya nagre-reflect ng malaking problema as of the moment. Okay, but possibility of infection may occur kasi nga meron tayong alterations in skin integrity. Ano yung alteration? May hiwa. So may opening. Okay, secondary to surgical procedure. So possible na mag-develop ang infection, okay, kasi nga may alteration in skin integrity and we want to prevent it. So we can make use of race for infection as a diagnosis because the patient has a race and we have to prevent it from happening. So as of the moment, wala siyang actual problem and we want to prevent that from happening. Okay, that's why I decided to make use of risk diagnosis for this one as your nursing diagnosis. But again, we can still make use of acute pain. However, pag acute pain po kasi dapat at least above 5, okay? But for this one, since wala naman tayong pain scale. So mas nag-focus tayo sa nursing diagnosis na risk diagnosis. Okay, sana maliwanag po tayo dyan. Again, marami po yan. Pwede naman po yung irritable siya, yung pasyente is parang irritable, and of course meron siyang conscious problem. So or yung tinatawag nating hindi siya uh, how do I describe it? Yung parang irritable that may be in danger na siya may ma-fall. So the patient is risk for fall, or pwedeng malaglag, or risk for injury. Okay? So may problema sa kanyang paningin, risk for injury. May problema sa kanyang pandinig, risk for injury. Okay? So that is your risk diagnosis. And the last diagnosis, example of diagnosis that we're going to discuss is the wellness diagnosis. Ito yung kadalasan nakakaligtaan ng mga estudyante whenever they do their nursing diagnosis. Okay? For example, subjective data, nurse, pakisabi naman kay doc na ready na ako magpa-opera. Baka kasi pag pinatagal ko pa, lalo pang lumala kondisyon ko. Okay, that's actually a positive phrase coming from, or positive phrase or response from the patient, telling his readiness to undergo the procedure. Okay? Kasi pag magpapa-opera ang mga pasyente, kadalasan ng nursing diagnosis natin nandito is your anxiety. Okay? But there are also instances na pwede tayong magkaroon ng wellness diagnosis. Okay? Objective, patient verbalizes willing to participate to nursing care management and cooperative when nurse provides nursing care. So overall, the patient actually very cooperative, okay, with the treatment that was given to him or her. It means to say that these are actually possible strengths of the patient. Okay, strengths of the patient. Now, okay, what is the example of nursing diagnosis that we can use? So we can make use of your readiness for enhanced health management. And this is a standalone nursing diagnosis, or one part nursing diagnosis based on your NANDA. Because the subjective and objective data denotes that the patient is really ready for the management that the facility and the healthcare provider is giving to her or him. Okay, so that is an example, or those are examples of your nursing diagnosis that we can actually come up with based on the subjective and objective data. But of course, this will still depend on the situation, and of course depends on the data that you have collected during your actual assessment with your patient. Okay? So lagi po nating i-compare. Again, nakabase po ang nursing diagnosis mo sa mga data that you will be collecting during the assessment phase. Okay, so we will going to part on these slides. So we are going to discuss the continuation of your nursing process sa mga next videos natin. Again, if you're not yet a subscriber of this channel, please do subscribe to our channel, and don't forget to like, comment, and share it with your friends. That would be all for now, and see you again on our next video, my future nurses. Thank you, and bye for now.